Hydration and IV Therapy Part 2, Introduction to Nursing Concepts, Martha Olson, Iowa Lakes Community College. As we look at the impact of surgery on fluid balance, you'll have a whole surgical unit in your basics nursing course, but we look now at some of the things that do affect some of the patients we take care of. They go to surgery and they're NPO so they don't aspirate. The insensible loss is when, the wound is opened up during the surgical procedure. Estimated blood loss is something every nurse on the medical floor or surgical floor should ask the surgery nurse when they bring the patient back. What was the estimated blood loss? Do they have a drain? Have they been vomiting and have nausea? What kind of stress do they have? We know stress increases antidiuretic hormone and aldosterone, resulting in decreased urine output. Page 1268 talks about the surgical patient. Our risk factors then, some of our high-risk groups are listed here. Diuretics, your steroids, your potassium supplements cause GI disturbance, including gastric ulcers. As we look at calcium carbonate, mild metabolic alkalosis with nausea and vomiting for that, your milk of magnesium, hypokalemia, and some of your NSAIDs cause nephrotoxicity. As we look then at the integumentary assessment, what does the skin look like? Is it dry? Is it flaky? Is it real thin? The skin turgor, again, is not a good assessment tool for the elderly, but many times you can tell about the hydration status by looking at the skin of a younger person. When we look at rapid changes in fluids, oftentimes it's related to what's going on within the body. When the urine output goes down and the weight climbs, this is an indication of fluid retention. Our concern is the work of the heart, the congestive heart failure. If the urine output goes down and the weight goes down, this is an indication of fluid volume loss or deficit. We weigh patients daily. We want to do it on the same scale, the same time of day, and have the patient in the same condition. On the bed, make sure that you have the same amount that you weigh every day. One pillow, one soaker pad, one blanket. Whatever they cleared the bed when they admitted the patient is what you want when you obtain that weight. I know on the chair scales, if the patient doesn't have his butt scooted clear to the back of that chair, you can be off 5 or 10 pounds just by not having it done accurately. Having them go to void first before you get that 5 or 6 a.m. Weight is important, so it's consistent every day. And then with our best overall indicator, remember, it's not skin turgor, it's not intake and output, it's daily weight, because the other ones have too many other factors that can change that. Our patient with dehydration on page 887 in Potter and Perry looks at, that assessment. Their blood pressure's low. They might be confused because they don't have enough blood pressure getting upstairs to the brain. They may be lethargic, and it can be caused from many things. Maybe they're not taking in enough, or they're taking or losing too much excess out. Dehydration oftentimes can be with wounds or hemorrhage. Patients that have an increased temp are going to breathe faster as part of the metabolism. It increases the metabolism, and usually when you run a temp, you sweat, and they have increased fluid loss that way. That adds to that. Our signs and symptoms of fluid volume deficit are listed here. Remember how you obtain that orthostatic blood pressure: lying, sitting, and standing. If you have a patient that is orthostatic, we need to make sure that we use a gait belt. We allow them time to dangle at the side of the bed. Part of that assessment piece is used to determine how well the client handles the change in position. Why orthostatic hypotension is associated with fluid volume deficit is because it doesn't have as much pressure on those vessels. When a person is lying down, the blood is distributed evenly. When they go to sit up, then that blood pressure is going through those large veins, or not enough blood going through there. And it can go very quickly, kind of like the interstate in the middle of the night when there's no traffic. You can go and drive down the interstate very quickly, and the blood pressure then winds up down in the ankles, where the person then feels very lightheaded. The opposite effect then is our overhydration. Your patient is probably going to have a higher blood pressure because there's a lot of fluid in the vessels pushing that. You see the weight gain. The hematocrit is decreased because it's diluted out. If I have a lot of fluid on board and I have 42 little red blood cells and it's in a big pot of fluid, it's not going to look like very much. Whereas when you're dehydrated, that hematocrit level then would look very high because it's in a very small pool of fluid that we have. Why we get overhydrated? Typically it's renal or cardiac failure. It can be from excess IV fluids. Where I mostly see that is when you have a patient that has 2 units of packed red blood cells ordered, and we give those consecutively, and we have to get the blood in an amount of time so it doesn't grow bacteria. So you're running fluids in, and they're not able to excrete that as quickly, and they will go into a little bit of a congestive heart failure for you. So if you have an IV that you feel is excessive for what the patient is able to tolerate, when you start hearing crackles or fluid in the lungs, you need to be calling the doctor and just reporting these types of things to see if that IV rate is appropriate. Our treatment for fluid volume excess is to, stop the IV or slow it down. Give a diuretic if it's appropriate. We want to give them oxygen to be able to take and increase the amount of oxygen that is delivered to the cells. Morphine sulfate IV is often given because it helps improve oxygenation and it helps relax the patient. And with the dilation of the cardiac vessels, then it helps improve your cardiac output. We would want to always, get lung sounds, intake and output, and daily weights are part of our assessment that we do not have to have a physician's order to do, and it would just be expected as part of our professional nursing. As we look at fluid status and some of the alterations that happen with that in our assessment, we know that we can get a weight. 1 liter of fluid is the same as 2.2 pounds. So if you have a person with fluid volume overload, bring them in and give them a diuretic and they lose 2.2 pounds, you've taken a liter of fluid off. Our chair scales were used a lot in the past, but I'm seeing now more bed scales being used because you can weigh the patient without having to get them up out of bed. We always weigh first thing in the morning. The standing scale is often used in the clinic. Accurate weights are very important, and then make sure that we look at other things that tell us about fluid status, such as skin turgor, the color of the urine output. Some of our alterations in fluid balance. Our hypovolemia causes your heart rate to go up because it's pushing or pumping all of that fluid that's in there and trying to get it to where it needs to go. With fluid volume excess, their heart rate goes up because they've got all that fluid on board, and so our vital signs may change as a result of either hypo or hypervolemia to the body. People that are on a sodium restricted diet, it's typically because they have high blood pressure. We're trying to get some of that excess fluid off so that the blood pressure will lower on its own. Our GI losses that result or contribute to the deficit, your vomiting and diarrhea. I've had an instance where parents brought a small child in that had been with vomiting and diarrhea for a couple of days. This child, the eyes rolled back in the head, very limp, very ragdoll-like child, and it was very, very hard to get an IV in that child because they were so dehydrated by the time they were brought in. Your patient that's sweating or very diaphoretic may have a lot of losses, and then obviously your patient that gets diuretics. We look at the neck veins by having the patient sitting at a 45-degree angle. They turn so that you can see that neck vein. It distends out if they've got good blood volume, and if the neck veins are actually distended, we call it jugular vein distension, or JVD is oftentimes the abbreviation we have with that. It can indicate right-sided heart failure. Nursing diagnosis that go with this unit then, your fluid volume deficit and excess, decreased or increased cardiac output, your risk for injury related to orthostatic hypotension, and probably the number one on this list is the last one, your ineffective tissue perfusion, because if you're not getting blood out to the body cells, that is concerning. Our goals and outcomes to restore fluid balance include weights, intake and output, getting the IV in, picking the right size IV needle when you insert that. If they're going to get a fluid challenge or fluids very quickly, you need a 16, 18, or maybe even a 20 size IV to get that in. What rate and what type of IV solution we will be talking about in upcoming voiceovers, and then remember to encourage, fresh waters and juices if that person is dehydrated, to encourage water going in. Don't offer any diuretic type liquids such as coffee or tea or colas, because they actually have a diuretic effect for the person. For our implementation phase, then, we look at intake and output, types of IVs, what are some of the complications, and monitoring at least every shift. You can do it more often. A patient in the intensive care unit, I'm looking at that urine output every hour. As we look at what is needed, accurate measurement is very important. And for intake and output, the rule of thumb is if it melts down to a liquid, we count it. So anything like ice cream and jello, we would count as intake and output. Watermelon, grapes, lettuce, very full of fluid, but unfortunately we're not able to measure those. But if somebody was on a diet where we were encouraging fluids, those would be appropriate to add in as well. This ends our second PowerPoint. Next, we will be on to the purposes and more specific things about IV therapy in looking at that.